Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning and welcome, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I'd like to welcome you to this AHS Public Board meeting. And thank you for taking the time to join us. We have three matters to address today, one being the additional acquisition of personal protective equipment, and the other being two matters appointing volunteers who are part of the invaluable connection we have with the public, serve in the advisory process, and also assist us in funding the work that we do. So now on to the business of this meeting. We are participating today by telephone conference. When I ask for a vote on a motion, I will ask for those opposing or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none opposing or abstaining, or if a minority are opposing or abstaining, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Hugh Somerville.
Thank you, Hugh. Second?
Heidi Overgaard.
Thank you, Heidi. Is there anyone opposed or abstaining? Thank you. The agenda is approved. Based on the agenda that's been approved, are there any conflicts of interest that anyone would like to declare? Thank you. Hearing none, we will move on to the recommendations by our board committees. The first is from our Community Engagement Committee, and I will be asking Dr. Brenda Hemmelgarn, Chair of the committee, to provide a report and the recommendations.
Thank you, David. The Community Engagement Committee met on May 20th, 2020. The committee considered two items for recommendation for approval of the board: appointments and renewals of members to advisory councils, including chair appointments, and appointments of trustees to foundations. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. Given the number of appointments and renewals, the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. First are the appointments and renewals of members to advisory councils. The committee considered appointments and renewals to advisory councils, the appointment of the chair of the Addiction and Mental Health Provincial Advisory Council, and the appointment of the chair of the Cancer Provincial Advisory Council. The responsibility to appoint or renew these council members lies with the AHS board. The committee recommended the board approve the member and chair appointments and renewals as reviewed by the committee. The board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of members to the advisory councils, the appointment of the chair for the Addiction and Mental Health Provincial Advisory Council, and the appointment of the chair for the Cancer Provincial Advisory Council for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you, Brenda. May I have a seconder?
Glenda Yates.
Thank you, Glenda. Are there any opposed or abstaining from this motion? Thank you. The motion is carried. David, we move on to David Carpenter, Chair of the Finance Committee.
Sorry to interrupt, David. There was just the appointment of trustees to foundations.
Thank you, Brenda. I apologize for cutting you off.
No problem. So second, with respect to the appointment of trustees to foundations, the responsibility to appoint trustees to establish foundations lies with the AHS board. The committee recommends the board approve the trustee appointments as reviewed by the committee, and the board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Stephen Mandel, I second.
Thank you, Stephen. Any opposed or abstaining from the motion? Thank you. The motion is carried. And now, without further ado, David Carpenter, the Chair of the Finance Committee.
Thank you very much, Mr. Chair. The Finance Committee met on May the 15th, 2020. So as Chair of the Finance Committee, I'm presenting one motion for approval today. Alberta Health has announced additional financial support for healthcare aides in contracted continuing care facilities and additional operational funding for additional facility support. Given the distribution of this additional funding exceeds the AHS President and CEO's limits under Policy 1100, Delegation of Authority and Establishment of Controls for Commitments, the committee was asked to review and recommend board approval. The committee did so, and the board also subsequently reviewed and supports the funding proposal. Accordingly, I move that the Alberta Health Services Board, 1, approve COVID-19 funding for the continuing care sector, which includes healthcare aid support and additional facility support on the terms and conditions reviewed by the Finance Committee and the board. And secondly, delegate signing authority to the President and Chief Executive Officer to sign the payment requisitions or revenue transfer journal entries for such funding. I so move.
Thank you, David. May I have a seconder?
Brian Vazjo, I second that motion.
Thanks, Brian. Are there any opposed or abstaining from this motion? Hearing none, the motion is carried. Thank you, everyone. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you again, and stay healthy. Bye.
Together, we do amazing things every day.